Good morning. This is Kelly Sheets with the Department of Medicaid Services. Welcome to the Home Health TAC this morning. Currently, I only see Susan and Evan on. If I've missed anybody, please speak up. Okay, well, I have 11 o'clock, but we will give it a couple of minutes and hope that a couple more TAC members join.
Our our chair is probably in the line of the storm. I'm not sure about the other two.
Yeah, yeah. Anlin said she definitely would be possibly not making it. So not
Okay.
sure about Teotis and Marlene, but we'll give them a couple minutes here.
Okay, sounds good.
Thanks, Kelly.
You're welcome. Okay, I am still showing just Susan and Evan, but if you want to go ahead and go get started, we do not have a quorum, but in the interest of time, if you want to get started, that's fine, and then I can let you know if any other TAC members join, if that's okay with you.
Oh, let's see.
Sounds good.
10, 11, it's a possibility.
All right. So we'll jump straight down to the old business and two topics for consideration there. So first up is supplies limits, which I think has been something have worked on the agenda for a few years, and just trying to narrow in on a bit of an answer and guidance for folks to know what the limits are in terms of billing supplies. So I think Aaron's had that on the radar here since the last meeting.
Hi, Evan, it's Kelly again. I have received a couple of reports one from Passport, one from WellCare. I can include those in the follow-up email that I send out after today's meeting. But if there's anyone else on the MCO list that would like to address, that would be great.
You should have received something from Humana as well. But we actually don't have any like plan specific limits. We abide by what the state has. So maybe that's why you didn't have something specific for Humana.
Possibly, yeah.
And Kelly, this is Susan. My question is, in the reports that you've received, is it all inclusive or does it have gaping holes?
I will send that out and let you decide.
Okay.
I can send that out right now if you'd like.
Because we've gotten data before, but it's a spreadsheet with gaping holes. So we'd like to have the information.
My assumption is that it might be what you've gotten before, the same format, but I will let you decide that.
Okay, thank you.
Thanks, Kelly.
Hi, this is Suzanne from United, and I would like to, I don't think I sent anything in, and I'm happy to if you need that, but similar to Humana, we follow what guidance the state has set and CMS rules. So there's not a specific list of supplies or codes or supply limits. If there were examples of something that wasn't getting paid, we would love to have those examples sent to us so that we can research it. If anybody has any, any issues with that, that would be helpful to us to be able to research what's not getting paid. I think if there are claims issues, just kind of talking through with my claims team, sometimes things can be, supplies can be added to multiple lines for the same item. And sometimes those can be kicked out as it looks like it might be a duplicate. So I don't know if that's something that maybe home health providers are experiencing. But again, without an example or a specific thing for us to go back and look and investigate and see, it's kind of hard to know the answer, but we're happy to do that and would love to be able to help if there's something that you guys are seeing, like, okay, this particular code, and if it's billed a certain way, this is what we're seeing, and it gets kicked out every time if we do X. Like, those are the kinds of things that could help us go back and investigate what our system may be doing.
I can maybe provide some clarity on that.
Okay.
But it's not about like a prior auth to get supplies. It's about the billing quantities. What is the billing quantity? So if Passport billing quantities for 4x4s is one box of 40, we don't know that. And yours might be 50. So we don't know what the billing quantities are. So if we bill it as over the billing allowance, then we get a denial, but we don't know what said threshold is.
Okay. Yeah, and like I said, we don't have a specific list of codes or quantities to that degree. So if you're saying that, again, if you have a code where you are seeing that happen consistently, it would be helpful for us to have that.
Yeah.
And my counter to that is you probably do. It's in your billing manual and it's in your billing edits. We would just like to know what those are.
Yeah, unless it's triggering against the state's billing guidelines, right? So if the state has limitations, then those are what, at least for Humana, we implement what the state has.
Yes.
And we abide by what the state has. And then if the state does, there are also some that may be published by CMS, where the state also abides by CMS's standards. But again, at least for Humana, we do not have MCO specific limitations on supplies beyond what state and or CMS has published.
Yeah, same for United.
So Kelly, if that's the case, is there someone we can talk to within DMS to confirm?
Yeah, I can take that back.
You all publish it. It's in the fee schedule. It has the supply limits a lot of times in those fee schedules.
Can you give me your definition of a supply limit?
From the fee schedule, I think I saw an example where it said 50 boxes, like it has a code and it says 50 boxes, something like that, or sterile. I think I saw something where it said sterile gloves 99 or something like that. I'd have to go back and look at the state's fee schedule, but there were specific units noted in there.
And my question to that would be, supply limits and billing quantities might be two different things, but we can go down this rabbit hole again, Evan.
Yeah, but again, similar to UHC, and I think this is probably true for all the MCOs, if you're actually seeing like, an issue with a claim, like a claim example of that is causing this issue, by all means, I don't think any of the MCOs would disagree that we'd love to see those examples and research that for y'all.
And I don't know if the the most recent fee schedule I can find on the website talks about limitations, but that's the only, those are all for incontinence products and adult, briefs or diapers. So I don't see any other limits as far as that goes.
I don't know, does also account for, do some of those things that you bill are also tied to the DME fee schedule by chance?
Shouldn't.
Not that we're aware. I mean, we can cross-reference, but yeah, there's only a handful of items on the fee schedule that have limits, and it's like betadine wipes,
Yeah,
a catheter, urethral clamp, ostomy vent, and a couple other things. So none of the things like the 4x4s, none of that is listed in terms of having a limit on a monthly or annual basis.
okay, and then if you are seeing a claim denied as if there was a limit, then we would recommend you send that to us as an example so we can research those.
Yep, we'll do that again. Yep, happy to.
Great.
All right, any other MCOs on the supplies limits discussion? All right, hearing none.
Well,
We'll go down.
I was
Go
just gonna say,
Hey,
I was gonna
Stuart.
say, yeah, good morning, Stuart on with WellCare. We sent the list, and an issue in the past, because we've talked about this before, is because we also do CMS limits, DMS, and some of the CMS limits are proprietary. And so we point that out on our list. They're part of the medically unlikely edit, MUE, and they actually cannot publish it. And the rationale is that, you bill whatever is needed, based on the plan of care for the member. And that if the limit is published, then coincidentally, that's how much would be billed. But we've noted that some of them are CMS proprietary, so we don't publish those because it's forbidden to publish them.
Do you know if like 4x4s falls into that category, Stuart?
No, I'm sorry. I don't.
Okay. We'll dig
Can
down
you,
on that.
4x4s, can you elaborate?
Susan, it's just a bandage, right?
It's a gauze, 4x4 gauze.
Got it. Okay.
All right, we'll jump down to the next item. So this data for home health aid utilization, we've put that request into DMS. I think it's still in progress. Aaron and I were just exchanging some emails on that today. So, but that's something we're definitely interested in, just for discussion purposes here today. We have seen, the erosion and almost, kind of underutilization of home health aides within the home health benefit across Kentucky. So we're interested to see what that data looks like over the last, I think our range will be kind of 15-20 years, just to see the utilization trend and see where things stand currently. So that request has been put into DMS and should be forthcoming here hopefully soon. So we'll jump down to new business. So Clorox drains being covered, I think that was listed as in progress by DMS last discussion we had. So Kelly, I don't know if you have any update on that from DMS's side.
Yeah, April, are you on? Are you able to discuss?
Yes, Kelly and Evan. So we are continuing to look at adding that code. We did find it on the DME fee schedule, and we are long-term services and supports is working to get that added and republished.
Do you have any idea, April, what the delivery date will be on that?
I do not, but Kelly, if you help me take an action item, or Aaron, we will follow up.
Well,
All right, so we'll get some additional follow-up on that. Down to item B. Some providers experiencing issues with billing and getting paid for claims. I think we have a well care example here related to condition code on the claim. I think there was some separate dialogue on this. I don't know if we reached resolution, but wanted to have it on the agenda for just for flagging and discussion purposes here today.
Hey, Evan, yeah, I know, we've been working with, I think, a couple different providers. I'm trying to pull up the summary, and I think Christina Rose and Aaron Allen are on, not exactly to throw y'all on the spot, but I mean, there are I know we got specific examples. We've been researching them, and I think it gets a little bit convoluted. As far as like whether it really is the condition code 12, or that there was another issue, and I'm trying to pull up the summary. I don't know if Christina or Aaron, if you want to add anything, but I mean, it is like a couple specific providers we've been working with, right?
Hi, Stuart. This is Aaron. Yes, there
Thank you.
are a few providers that we are working with. I'm not certain. We're not clear yet if it has to do with the condition code 12 or the admission date being listed on the UB. Our operations team, Libby Caudle, is still working on that, but we are actively working on this issue.
Yeah, that's the admission date. That's what I was, I forgot about. Yeah, it was like it could be that instead of the actual condition code. That's the issue. That
And then
providers
Libby,
are, yeah, reporting the admission date on the claim. I think that's could be the root of the problem.
and then also an admission diagnosis. I forgot what block that was in on the UB, but it's still kind of not clear what the issue is, but we are still working on it.
All right, thanks for the update. If you need any help from our end, please let us know, but appreciate you all working with the providers on that issue.
Evan, I have a question for Stuart, if you don't mind. I want to go back to the supply question.
Yeah.
So Stuart, you said that the MUEs were proprietary by CMS. So does that mean that every that you all should be standard on what your MUE is, or not, based on or can every one of you all have a varying MUE?
So I mean, we use CMS and DMS, so I think we're probably uniform, but the ones that are proprietary, we don't include those on the list. The ones that are CMS proprietary, we don't include on the list. I would think that we're all uniform on that.
And I think that's where our problem is, Evan, is they're not uniform. And maybe our question needs to go to CMS.
Well, and we even, because we did this, I remember doing this before, and we actually, which was kind of like good luck and, who at CMS, and we did, and we ultimately got an email. It was maybe like 4 years ago from somebody at CMS that confirmed, yes, it's proprietary. But yeah, I mean, I don't think everybody has to use CMS limits. We do, and then, like I say, we do, including the ones that are proprietary, and we don't publish those, but
because we happen to know that your limits are different than somebody else's limits.
Yeah.
And what happens is you bill a claim and you'll have 40 4x4s and it'll get denied, and then you work backwards, okay, 35, and then okay, that one gets paid. So you either it's the number's somewhere between 35 and 40. So did you miss out on billing 5 4x4s or what? And we know that your MUEs are different than somebody else's MUEs. So, you know, I think that if CMS is the one dictating that maybe we need to take that a different direction, Evan.
Yeah.
Because it's not standard.
By the way, I did post in the chat some of the gauze codes that are on the MUE CMS site. Just, of course, it does say proprietary, like Stuart said, but it at least it gives you visibility of some of the codes that would trigger, we would expect to trigger.
Maybe Elon Musk will fix this too.
All right, I'm going on mute now.
Yeah, me too.
All right. Well, thanks for the discussion on that. I mean, we definitely want to track down the nature of the issue here. So I can try some channels through the national group, Susan, to reach out to CMS and see if we can get some clarification from their side.
And Evan, I have another new business that I didn't get to you because it came up yesterday. And I know we just to put it out there, we're getting denials for EVV visits that are prior to January the 1st. And wanted to know if anybody else was experiencing that.
Is that data service prior to 1/1/2025 data service?
Yes.
That shouldn't be happening for Humana. If that is, I'd like to see examples.
Okay.
Yeah, I was gonna say if you and I'll put my email in the chat if you have examples like with WellCare, because we always need examples of the staff can research. I'm not aware of it, but if you have examples, yeah, we can definitely research it.
Okay. That was all I wanted to add, Evan.
And if you have any examples for UHC, Suzanne put her email in the chat.
Okay.
All right. Item C, if we're ready for that, the switch from Anthem to UHC. And we have an example we run through here. Looks like some of the patients are the providers out of network for them. So,
Hey, this is Suzanne from United. I had a question about this one. I was really curious. Are the providers not familiar with continuity of care process and like when a patient switches from one MCO to another, that there's like continuity of care? Anyone familiar with that?
I don't have any. I mean, I'm not sure if they're
Okay.
unfamiliar with that or what the issue is. This is the detail that we had passed along for this.
Okay.
So,
And we don't know who was concerned about the switch, which provider?
I think this one came from Marlene, if I'm not mistaken. So she is with LHC Group.
Okay, I'm not familiar with that group. So in essence, anyone who is switching from Anthem to the new MCO, it's, United and Humana, we're taking on the membership from Anthem. We do have a continuity of care plan, and that is to assist our members coming in to continue receiving the care that they need with their providers while we work on trying to get those providers in our network if they're not already, and just making sure that that the members have the services that they need. So I think that without being able to ask the questions directly or have the exact example, I was a little bit surprised by this, to be honest, because if the provider is calling all of the members from Anthem, and then telling them to switch. That's concerning to me. And without, contacting United and saying, hey, we've got a group of members and they're all, Anthem and calling us to work, to kind of work through that. I think that's the most concerning part that I had when I read this. So we want to partner with the home health agencies. We want to make sure that our members get what they need. And we want to be able to have the opportunity to do that. And so I would just say that if you could give us the name and contact information of whoever sent this in, we would love to reach out to them and see how we can partner to make sure that the United Healthcare members get the services that they need and we continue the care and work with that particular provider to see if we can get them in network. But I think we would like that opportunity. And then I have our director from network on the call with me. Noel Harrison is on. Noel, do you want to add anything?
No, I think you summed it up nicely, Suzanne. I think the bigger concern for us was this last part, that they're asking members to contact, connect, and switch if they want to continue receiving supplies from this provider. We have every desire to work with this provider, but we hadn't heard anything until this popped up on this agenda. And so we've been trying to work to find out who the provider is so we can do some outreach. So I don't know if anybody on the TAC who knows who it is can, share that. I'll put my email into the chat so you can have mine as well, to send over who the provider is or the contact we can reach out to find that out. If you want to send that via email to Suzanne or I.
And for Humana, same thing as Suzanne had stated, we absolutely abide by the existing prior authorizations that should be on file for these members receiving this care. And then we also work to try to get the providers within the network. But if they don't choose to do that, then we will work with the member to migrate to a participating provider in the long term.
And Suzanne, I teed up an email, so I'll send one to Marlene from LAC and copy you, and hopefully y'all can connect. I think we had sent one previously, trying to connect with another member of your team. So we'll hopefully y'all can get together.
Yeah, wonderful. Thank you.
You're welcome. All right. Anything else on that item? And if not, we'll move down to number 6, just general discussion updates from the MCOs. So Suzanne, since you were already teed up, we'll start with you all from United. Any updates there?
I don't have any updates right now. Noel, do you have anything?
No, this is my first home health TAC. I'm familiar with the TAC system, fairly new with United. So just want to introduce myself as I'm the provider network director here for United Healthcare. We'll be on these going forward as well. We'll defer to Suzanne for most of the time, but I always want to be here to provide assistance and any input I can. Unfortunately, today I don't have anything, but an introduction. So,
thank you, Noel.
Thanks, Noel.
I guess Humana.
Go ahead. Sorry, go ahead.
No, I was gonna say no. We have not noticed anything that's out of the norm from our prior discussions we had in December. The EVV seems to be going fairly quietly for us. So we haven't, like I said, we haven't really seen any issues. If there's anything in particular tied to Humana, well, by all means, we're interested in seeing that. And I did share the email in the chat.
Perfect. Thank you. Go ahead, Stuart.
Yeah, I can jump in again. Yeah, same thing. And same report about EVV. It seems to be going well. I know it was extremely painful, all the, condensed timeline, which is mandated by CMS and everything, but it seems to have actually launched. pretty well. We, our auth approval rates are real high, 95% or something like that. So, other than what we talked about earlier, with a couple of providers with the either condition code or admission date or whatever, I'm not aware of any issues or anything, and nothing related to home health that's new.
Thank you. Passport.
Good morning. This is Anna Page, the Director for Utilization Management. I am taking the place of Teresa Slattery, my manager who usually attends. She is off, but no issues noted with home health or the providers at this point. None to report.
Thank you. And Etna.
Hey, this is Crystal with Aetna Better Health. I wasn't sure who was on from our health plan, but at this time, I don't think we have any issues to report. No concerns that have presented with, any kind of claims data pool or anything like that. But I will drop my email in the chat for anyone to reach out if you do have issues that need to be addressed.
Thanks, Crystal.
Evan, this is Kelly. I did want to let you know that Tudis just joined, so you do have a quorum at this point.
Okay. Thank you. Do we need to, I take we need to go back and approve the minutes.
I'll make that motion, Evan.
Okay. So Susan moves to approve the minutes. Teotis can have a second. Perfect. All those in favor say aye.
Aye.
Any opposed? All right. So that takes care of the minutes. And we're down to updates from DMS and or Commissioner Lee.
Commissioner Lee was not able to join. Is there anyone from DMS who has any updates they need to provide? Okay, hearing none, I'll turn it back over to you, Evan.
Thanks, Kelly. So on to recommendations. So we don't have any recommendations for today's purposes. I think we will in our next meeting, just on the basis of the discussion about both supplies and home health aid utilization. So be on the lookout for those next meeting. MAC meeting representation, we still have Susan in that role. So then our next meeting will be April 8th, 2025. So unless anybody has anything else for the good of the order, we will go ahead and adjourn for today. All right. Thanks, everyone. Appreciate it.
Everybody have a good rest of the day.
Thank you.
Talk to you all soon.
Thank you.
Thank you.